Welcome to FASD Unveiled, shedding light, spreading awareness, and building support. I am Shannon Day, an Education Program Manager with Illuminate Colorado. Illuminate Colorado is a statewide nonprofit that is committed to making Colorado the best place for children to grow and thrive. In the next few minutes, we are going to shed light on fetal alcohol spectrum disorders, or FASD, and the cause and impacts of FASD. We will learn more about the challenges and benefits of identifying FASD, increasing and spreading awareness, and talk about the importance of prevention. In addition, we will discover how to build supports for those impacted. So, what is fetal alcohol spectrum disorders, or FASD? FASD is a brain based, lifelong physical condition that can impact the brain and body of people affected by it. True or false? Fetal alcohol spectrum disorders is a diagnostic term. If you answered false, you are correct. Fetal alcohol spectrum disorders is not a diagnostic term, but an umbrella term intended to encompass all the diagnostic categories designated by the Institute of Medicine. FASD diagnoses are based on particular symptoms and can include some of the diagnoses listed here and here. To learn more about the diagnostic criteria and any of the possible diagnoses that fall under the FASD umbrella, visit fasdunited.org. Now that we know that FASD is an umbrella term that can encompass a variety of diagnoses, let's talk about the cause of FASD. Take a moment and choose which one of these you think can cause FASD. If you answered C, exposure to alcohol in the womb, you are correct. Why would exposure to alcohol in the womb possibly cause fetal alcohol spectrum disorders? Alcohol is a teratogen. The teratogen is a chemical that can cause abnormal development of the brain and other organs in the fetus. When a pregnant person drinks alcohol, it enters the bloodstream of the fetus without barriers. The developing fetus cannot process and eliminate alcohol from their system, so it can have an effect on the development of the fetus. This chart shows the true gestational age of the fetus, the weeks from conception. The dark colors on the chart are windows when more severe damage or disruption to the development process can occur. The lighter colors are times when minor damage can still occur. Note that the central nervous system of the fetus is vulnerable to alcohol throughout the entire pregnancy, especially in the early stages, so the brain is always at risk. Based on this information, let's pause and think about when it could be safe for the fetus for a pregnant person to consume alcohol. What do you think? When a pregnant person consumes alcohol, when is it safe for the fetus? If you said D, you are correct. There is no safe time to consume alcohol while pregnant. It is important to recognize that anytime there's alcohol exposure during pregnancy, it is possible that an FASD will occur, which can cause brain differences. How harmful can alcohol be to a fetus? True or false? Alcohol causes more severe harm during pregnancy than heroin, cocaine, and methamphetamine. If you said true, you are correct. Remember that a developing fetus cannot process and eliminate alcohol from their system, so the development of the fetus can be disrupted or negatively affected. In addition to the fact that it can cause more harm than these substances, the severity of FASD can also be influenced by the amount of alcohol consumed and the timing during pregnancy of alcohol consumption. How often is a pregnant person drinking alcohol? CDC researchers found that nearly 14%, or 1 in 7 pregnant people, reported current drinking. Current drinking is at least one alcoholic drink in the past 30 days. They also found that about 5%, or 1 in 20, reported binge drinking. Binge drinking is consuming four or more drinks on at least one occasion in the past 30 days. So, if alcohol can be so harmful to a fetus, some may wonder why a pregnant person would drink alcohol. This can happen because between 40 to 50% of pregnancies are unintended. Unintended pregnancies can occur when no children or no more children are desired, or the pregnancy is mistimed, such as earlier than desired. In addition, often pregnant people may not be immediately aware that they are pregnant, and it may be up to 4 or more weeks before they realize it. Once they are aware of their pregnancy and attempt to schedule a doctor's appointment, it may be days or weeks before they can go see a doctor. So, prenatal care is often beginning late in the first trimester. Pregnant people may be drinking because they are unaware that they are pregnant. But there may be other reasons that individuals may drink while pregnant. Drinking alcohol in the United States is very common. According to the 2022 National Survey on Drug Use and Health, 84.1% of adults ages 18 and older reported that they drank at some point in their lifetime. Other factors can include substance use challenges. Perhaps the pregnant person has experienced abuse or trauma. They may receive mixed or unclear messages from friends, family, social media, and even healthcare professionals about whether it's safe to drink while pregnant. And many, including healthcare professionals, are not aware of the impact of alcohol on pregnancy. With all of these factors, we can begin to see that it is not always as simple as yes or no when discussing this complicated issue of consuming alcohol while pregnant. It is also important to note that it is never too late to stop alcohol use during pregnancy, and stopping alcohol use will improve the health and well being of the fetus. We have discussed what FASD is, the cause of FASD, and considered the fact that a pregnant person drinking is actually a complicated issue. So, now let's take some time to discuss some of the impacts of FASD and how they might show up in one's life. Remember, if an FASD does occur, it is a brain based, lifelong physical condition. The effects of these conditions may be physical, with low birth weight, below average height and weight, and poor coordination. They may be overwhelmed by sounds, textures, lights, and may need constant movement of some sort. There may be cognitive and mental challenges with delayed development, a short attention span, and they may be easily distracted. Behaviorally, they may experience difficulty with social situations, have poor impulse control, and ability to communicate. A person with FASD may have learning disabilities and a difficult time focusing. Often, a person with FASD has a combination of these conditions, and these conditions can affect each person in different ways, and the effects can range from mild to severe. It is also important to remember that symptoms will vary from one individual to another. No two with FASD will be exactly alike. And you may not always be able to tell if someone has FASD. We will talk more about that in a bit. So, how many are affected? The CDC reports that up to 1 in 20 school children in the US may have FASD, and that between 39 to 86% of all pregnancies are possibly exposed to alcohol. Imagine endeavoring to navigate everyday tasks with the physical, cognitive, and behavioral issues we just discussed. These issues may also show up in social settings, school, work, and at home. They can cause frustration for those who don't know about the effects of FASD, and it can cause teachers, caregivers, and parents to think that a child is just being difficult and won't do what they are asked to do. It can cause employers to think the same thing of employees. The fact that FASD is often underrecognized contributes to the frustration. Based on what we have learned so far, why do you think FASD is underrecognized? If you said D, you are correct. FASD is underrecognized because there is stigma and shame associated with it. It is often misdiagnosed or not diagnosed at all, and that just adds to the challenges that those impacted by it may face. There is a lack of public awareness about the danger of drinking while pregnant. So many are not aware of the lifelong effects it can have on the brain of an individual born with FASD. Medical, mental health, and education professionals receive little training about FASD. So, information they provide may not always be accurate, and they may not know how to work with individuals impacted by FASD. In addition, one of the big reasons that FASD is underrecognized is because the impacts are invisible. While physical differences can result, fewer than 10% of individuals affected will have the facial features associated with FASD. That is why it is often referred to as the invisible disability. Since there is no outward appearance of disability, when individuals are struggling, they are often told to just try harder or stop being lazy. When they're unable to follow directions, they're labeled as defiant. And when they can't focus or sit still, they're often called a troublemaker. They begin to get judged and labeled for their behaviors, which are secondary to the brain based condition they have. This is why identifying FASD is vital. And there are numerous benefits to identifying it. Stigma reduction creates space for individuals to talk about it and receive support. There are numerous resources available for those impacted by FASD, and through them, support can be found. Identification improves outcomes for those impacted by FASD, and a better understanding of behaviors is a tremendous benefit that can reduce frustration for the individual with FASD and those who care for them. With this understanding, you can also begin to shift your perspective and think brain first. Stay open and curious to the question of what if? What if this behavior is because of the brain based condition? And what accommodations can be made for the individual with this invisible disability? In addition to identification, in Colorado, when an individual receives a diagnosis, individuals may qualify for some or all of the services listed here. These services, again, can do much to support those impacted with FASD, and outcomes for all can be improved. We have discussed what FASD is, the cause and impacts, and considered awareness around what is often an invisible disability and the value in identifying it. But let's take our awareness discussion even further. How can we raise awareness and increase prevention? Healthcare providers should discuss alcohol use with anyone of reproductive age and screen for alcohol use with pregnant people. In a 2023 Morbidity and Mortality Weekly report, CDC researchers found that 80% of people who were pregnant were asked about alcohol use. However, only 16% of those who self reported drinking within the past 30 days were advised to quit or reduce their use. These findings highlight missed opportunities to integrate alcohol screening and brief intervention in practice. More and enhanced education is needed for medical providers so that they are trained to have these conversations with those they see. In addition to healthcare professionals discussing alcohol use with anyone of reproductive age, we can all share this important information with our friends, family members, and others. Talking about it can do much to reduce stigma and shame, and it can do much to spread awareness and increase prevention. Awareness leads to prevention. Other things that can be done to increase prevention include avoiding alcohol if pregnant, might be pregnant, or trying to become pregnant. If needed, seek help with substance use, and remember that it is never too late to stop drinking alcohol while pregnant. In closing, let's talk about building supports for those impacted by FASD. Illuminate Colorado has an FASD support program, which provides support for navigating the challenges faced by those impacted with FASD, and a training program to provide vital education regarding FASD. Visit illuminatecolorado.org/FASD support and click on Find Support. Then complete the request form and a navigator will reach out to you. In addition to Illuminate Colorado FASD support, you can also find helpful information from FASD United, the national voice on fetal alcohol spectrum disorders. It is an excellent resource and can be found at fasdunited.org. Support Colorado, supporting perinatal substance use prevention, recovery, and treatment in Colorado, is a statewide steering committee that can provide support, resources, and is a great way to get involved in FASD prevention. Visit illuminatecolorado.org/support Colorado to learn more. Shira Shump is the FASD Support Program Manager, and once you have completed the request form, you can reach out to her with additional questions. For training requests, reach out to Shannon Day. Thank you for investing your time in FASD Unveiled, shedding light, spreading awareness, and building support.